Bismillahirrahmanirrahim. Assalamualaikum everyone. Myself Dr. Maimuna Azhar. By profession I am a physiotherapist, and today I am going to deliver a lecture on the subject of medical physics, and the topic for today's lecture is on the stimulation of denervated muscle. In last lecture we have studied about stimulation of innervated muscle, and today's lecture is about stimulation of denervated muscles. First of all, coming towards the topic denervated muscle. What are those muscles? Denervated muscles are those muscles whose innervation has been degenerated. The nerve supply which supply the nerve root and nerve that supplies to our muscles, they are being degenerated at some points, so they are unable to produce proper contraction in that muscle. So according to that we say it is denervated muscle, and in that denervated muscle we want to produce some stimulation. Why we want to produce some stimulation in denervated muscle? We want to stimulate that muscle, we want to regain its activity, we want to regain the normal muscle function which was being produced and which was being done by that muscle. Now, stimulation of denervated muscle, how we can do that? When a current is applied to denervated muscle, the muscle fibers can be stimulated directly. So for example, you want to stimulate a bicep of the person which is denervated, and you are applying the device, you are applying the current directly on the muscle. So the muscle would be stimulated directly by the application on that muscle. And if you want to stimulate some other muscle, you want to stimulate tricep, hamstrings, quadriceps, whatever the muscle you want, you can do it instantly directly just by applying the current on that muscle. So it is clear that if we want to stimulate any denervated muscle, we have to apply current directly over that. So we can identify that we have got the moment. And what is the procedure? As we just identified that there was a resting potential, and when there is a falling potential different, the ions are moving inward and depolarization, and the process of polarization is occurring. In the same way, in the same manner, this process is occurring in denervated muscles too. Falling potential difference and the ions are moving inward, and the wave is being transmitted, and contraction is occurring in the muscle. So the process is quietly clear. The process which occurs in the innervated muscle, the same way it occurs in the denervated muscles. Now the point we need to consider is that denervated muscles denervated muscle does not react to electrical stimuli of shorter duration. When we apply the current of shorter duration on the denervated muscle, we have to remember this point for the MCQ purpose and for the short question too, that denervated muscles are not stimulated by the short duration current. So we need to consider this point every time we want to apply any kind of current on the denervated muscles on any patient. We have to consider this point at the first. If the current is having the short duration, if the current is of short duration, so it is a clear no for this patient. But provided that intensity of the current and duration of the stimulus are adequate. Intensity and duration, they are having a direct relationship, which we will learn few minutes later, just after identify the other things, few things of this topic first, and then we will dig towards the duration of the current. As each muscle's fiber must be stimulated directly, the maximum when the current passes to the greatest number of the fibers. For example, if we want to stimulate the muscle and it is being stimulated directly, so we have to apply the current on the maximum number of the fibers, because we know that if it is attached on the maximum number of the fibers, it will give the most contraction. The more number of fibers will produce contraction, and we can see the visible contraction in the denervated muscle. So for that, if you want to apply the current in a muscle in a manner that you get maximum stimulation, what can be that manner? It is usually applied with longitudinal application. One electrode being placed over each end of the muscle belly. Each end of the muscle belly, where you find that the muscle belly is ending, you are applying that. For example, the muscle is having two ends and one belly, and where you find that the muscle belly is ending, you are applying you are applying that current in the longitudinal manner, so that you are easily accessing all the muscle fibers which are present in the single muscle, just for the purpose we are getting the maximum contraction in the muscle. Now the type of contraction, what type of contraction we can get in the denervated muscle. A single stimuli causes an isolated muscle contraction. It is really clear and it is really simple. If the current is giving just one contraction, one stimuli, obviously the resultant would be single contraction, as there is one stimuli, one contraction. If you are giving more stimuli, there would be more contractions. And but in the process in which we are just giving the single isolated muscle contraction, this and the relaxation are the sudden when there is the muscle is stimulated through its motor nerve and is described as sluggish. So if we are stimulating the muscle through its motor nerve, and the current is being applied directly on the muscle, and in that process what you will notice that the contraction is sluggish, because single contraction, it would not all even produce some relaxation in the muscle, rather than it would create some the process which is not relaxing, and it would be really sudden, and in that process which is really sudden and really quick, it would give some sluggish movement. So to prevent that, to demonstrate the contraction, it is advisable to use impulses with the duration of at least 100 milliseconds. So the point to ponder and point to remember in your mind that 100 millisecond duration of the impulse must be used for the contraction in the muscle, because it is really important and it is advisable, which can produce contraction, and these cannot be repeated with stimuli frequency to produce a tetany, and they should not be repeated with enough frequency that they are producing tetany. Like you are giving the duration of 100 millisecond and the frequency is really high that the muscle is just giving the tetany contraction. We do not want to do that. Strength of the contraction, this depends upon the number of the muscle fibers stimulated. So if we are stimulating the more number of the muscle fibers, the higher would be the strength of the muscle